Hi, Mike Gibson and Dr. Zhang coming to you virtually from TCT 2020, and we're talking about the use of IVUS to guide optimal stent deployment versus traditional angiography. Dr. Zhang, you had presented the result of the ultimate study, the one-year results, but now you're back to report the three-year results. So talk to us about what you found.
Yeah, actually, 2 years ago, I presented a one-year result of ultimate. So I think 2 years has passed. This time, I think this study is aimed to explore the difference in TVF 3 years after IVUS guidance versus angio guidance for glaucoma patients undergoing second generation DES implantation. So in this study,
this is all lesions, all locations, all ACS and stable angina, correct? All comers.
All comers, yeah. So a total 1,448 glaucoma patients, including ACS, stable and unstable patients undergoing DES implantation, or randomized assigned to either IVUS or angio guidance. So actually, the results show at 3 years, TVF occurred in 47 patients, 6.6 patients in IVUS-guided group, and in 76 patients, 10.7% patients in angiographic guidance group. Actually, the difference mainly driven by the decrease in clinical driven TVR, 4.5% in IVUS group versus 6.9% in angio guidance group. And also we revealed the definition of all probable stent thrombus was only 0.1 in the IVUS guided group and 1.1 in the angio guided group.
Wow, so 2.5% absolute reduction in target vessel failure, that would mean you'd only need to treat 40 people with IVUS or use IVUS in 40 cases to reduce one target vessel failure, and then almost a 1% absolute reduction in Harder MACE, right? Stent thrombosis. That's very, very big. I mean, you'd only have to do 100 IVUS procedures to prevent one stent thrombosis. So very, very interesting. Was there continued divergence of the curves over time, or did they remain parallel after a year?
Actually, according to a landmark analysis, between 1 year and the 3 year follow-up, actually the difference between IVUS and angio actually is still parable, a little open size.
So a lot of the difference you're saying emerged in the first year and that was maintained through 3 years.
That's right.
Okay. Has this changed practice in your country? I mean, do you do IVUS in all your patients or select patients? How do you use IVUS now based upon these results?
Actually, in our CAS lab, I think nowadays we use, for IVUS guidance PCI in complex PCI, high-risk PCI, like left man standing, bifurcation need a two-stent technique, and also CTO lesions, lung lesions. Actually, so far in China, according to the statistics, only 10% of PCI cases will be used IVUS guidance. However, after the ultimate trial published and the penetration of IVUS guidance was increased gradually, especially in recent 2 years.
And would you expect the same findings for OCT, and where does OCT fit into your practice and into the practice in China?
Yeah, yes, that's a very good question. Actually, although so far there is no, we still wait maybe Illumin 4 data, but I think intracorneal imaging either IVUS or OCT can improve the clinical outcome for PCI patients.
Great. Well, again, congratulations, Dr. Zhang, to you and to your entire team. Very important study, very important findings showing a durable benefit in an all-comer study with IVUS. Thank you for sharing, and thanks to all of you for joining us here virtually from TCT 2020.